As I listen to these people, I get so many questions in my mind that I have to remember my adage that please hold your questions until we're all done. That was very interesting, Nancy. Tammie Poe is our third speaker. My notes here said that, Tammie, you grew up in Viola, and Viola was mentioned here previously, worked in sales and marketing for over 30 years, mostly in the optical industry. For the past 3 years, she's been the sales and marketing director at Good Samaritan Society here in Moscow, where she works with seniors and or their adult children to help them understand housing options and assist them with the application process. And apparently you also, Tammie, are responsible for Good Sam's fundraising, resource development, and you volunteer with the Alzheimer's Association. I know you've had some work with them, helping with part of their annual Alzheimer's Walk Committee, and et cetera, et cetera. This time, Tammie, it's all yours.
Thank you. As Gary said, my name is Tammie Poe. I grew up out in Viola. I am the daughter of a salesman and a nurse, so it was only a matter of time before I became a salesperson in the healthcare industry. So I am very fortunate to work at Good Samaritan Society, which is one of our larger employers here in Moscow and has been a staple of our community for over 40 years now. So it's very stable and it's a very wonderful place to work, and I have really enjoyed the interaction I've had with the residents that I work with and with the folks that I help to move into Good Samaritan. Some of the things that Nancy suggested I might want to talk about is how senior housing has changed over the years. The biggest changes that we're seeing, obviously, are as we have the silver tsunami that everybody talks about with the baby boomer generation, is just a complete shift in expectations for their housing. So, you know, the generation that grew up during the Depression, they have much lower expectations. They may have some built-in biases that were probably in some cases valid regarding senior housing, especially the skilled nursing care. And they like more conservative. They play bingo. They like to listen to old music, that type of thing. And as we have these younger baby boomer generation coming up, we're seeing a complete shift toward a more sophisticated and tech-savvy mindset, and people that don't really get involved in the traditional activities that a place like Good Samaritan would provide. They want something a little bit more person-centered and a little bit more technical. So we're seeing, a lot more use of things like the Wii and computers, iPads, things like that. We're also seeing a shift architecturally. Good Samaritan at Moscow Village, as I mentioned, is about 40 years old. And if you walk in there and I'm giving you a tour, there's no question that there are some things that I wonder, when they built this building, were they really thinking about who they built it for? Because there's some things that maybe we would like to see a little differently as far as the layout. So when we went to do construction on Fairview Village Estates, which is our secondary campus here in town, we really thought about the seniors that would be eventually moving into these units, and what kinds of things could we do to make that transition easier, also make it a very livable space that would accommodate a lot of different physical needs. So for example, I was telling Nancy that one of the things that they did that I just thought was genius, I would love to do this in my house, is they built the dishwashers about a foot up off the ground. So instead of having to bend over all the way, you only have to bend over a little bit to get to your dishes. So just that mindset of making the houses a little bit more accommodating to the age group, at the same time also making sure they have the modern conveniences, the open floor plans, all of the things that seniors in the baby boomer generation have come to expect. We also, as facilities, in terms of the assisted living and the skilled nursing side, we are, as Good Samaritan is actually going through an organizational merger with another company called Sanford Health, which is a nonprofit hospital system, mostly based out of the central, Midwest and East Coast of the United States. So we don't expect it to have very much effect on our location here, but the idea is, as Medicare regulations are getting more complex and medical billing is more difficult, we're seeing a shift toward Medicare regulations stating that a facility like Good Samaritan has to have a partnership with a hospital in order to have patients from that hospital transferred over for long-term care or even quick, short-term rehab at Good Samaritan. So the merger between Sanford Health and Good Samaritan is designed to facilitate that move and shift from a hospital setting to long-term care. And this is all happening right now. The merger will be complete January 1st. I'm sure we'll have more details coming out in the press about what that will look like, but that's one of the bigger changes that we see happening, probably not just with us. That's probably going to happen more and more. There'll be hospital systems that will want a footprint in long-term care, so they'll look for organizations like Good Samaritan that they can partner with. Right now, as far as the cost projections, 52% of people who reach age 65 will need some sort of long-term care in their lifetime. Right now, 10%, there's 10% of the Americans over 65 are in long-term care. That's projected to increase to, getting old enough I have to have glasses. So let me back up a little bit because I think I was reading the wrong line. Long-term care expenditures have skyrocketed from $30 billion in 2000 to $225 billion in 2015, and that figure is expected to go up to almost $400 billion by 2050. So just to give you some idea of what those costs look like, to have someone in a weekday adult care center is $18,200 annually. The median yearly cost for an assisted living facility is $45,000. The median yearly cost for nursing home care is $86,000 for semi-private and $97,000 for a private room. And with the increase in the number of people with Alzheimer's or other types of dementia, those costs are really going to balloon even more. So I'm really thinking about this for myself. First day after I worked at Good Samaritan, I came home to my husband. I said, we need to save a lot more money because it's expensive to get old. That's the truth of it. That's not going to change. Healthcare costs are going to continue to rise, and that coding and the billing and all of that is going to continue to get more complicated and more difficult to navigate. Let me see if I have anything else. But most of those costs, I will say, are born out of the private sector and Medicaid. Medicaid makes up about 50% of the payer source that we see in long-term care, and about 30% or 40% in assisted living. So Medicaid expansion was a huge issue for us this year because we have a lot of our residents that's what they require, that assistance in order to get the proper care that they need. And for us, the other thing that we're really concerned about is just basic housing for seniors in the low income or below the poverty line. There is definitely a real lack of those types of houses here in our community. So I think that's about all I have to say. And it looks like we have about 8 minutes for questions, so I will let Gary facilitate that. Thank you.